Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir here from the JWC studio, and today I've got the great Dr. Ashish Bhave here. He is one of the leading urologists here in Pune and the region, and more importantly, he's a very good friend. So thank you so much for being here, Doc.
Thank you, Kavas. Thank you for that introduction. And thank you for having me here at this lovely place of yours.
Absolutely.
My pleasure.
I've been
My
looking
pleasure
forward to
completely.
speaking with you for a long time. But as I said, one of the leading urologists here in the city.
I would not know about that. Debatable,
Well,
but I'll take it today.
absolutely,
Thank you.
as you should. But why don't we just start with that? What is urology?
So urology is it's a field of medical science that deals with diseases and, may I add, wellness as well
Yeah.
of the urogenital tract.
Okay.
So that's the kidneys, ureter, bladder.
Right.
Let's not forget the prostate,
Yeah.
urethra, and the male genital system like the testes,
Okay.
penis.
Right.
So we aim to keep them healthy and treat the diseases.
Well, then let's just start right there. How do we try and keep them healthy in the first place?
I mean, start with the mother of them all, the kidneys.
Yeah.
So main thing is just drink enough of water.
That's the number one thing that people always say. Hydrate.
Yeah,
hydrate.
and the number one thing that people don't do, especially in I mean, we live in India. It's a hot country.
Yeah.
And that leads, heat and less water itself, a dehydrated individual with concentrated urine can lead to a lot of
Yeah.
kidney diseases.
So how much should we be having every day? Everyone has a number.
So there's no real fixed figure, but
Yeah.
it should be, my teacher used to say, make sure your urine is white.
Huh.
So
Okay.
as long as your urine is white, you're drinking enough water.
Right.
So, someone may need 2 liters who's sitting in an AC room, a sedentary lifestyle. Someone who's a manual laborer, an athlete may need 4 liters, 4.5 liters.
Yeah.
So the right thing to see is the color of your urine.
Okay.
That should be white in color.
Regardless how often you're going in the day, because I
Yeah.
pee a lot every day.
Yes, yes, yeah. So if that's okay, that's no problem.
Okay.
That's no problem. And as far as you're comfortable,
Yeah. Right. of
you're,
course.
you're not uncomfortable. You don't have to rush. to
Every
the
half
loo.
an hour or something like that.
Yeah,
That's a problem.
that's bad then. But going 5-6 times a day, that's good.
Okay, that's pretty good.
Yeah, that's okay.
I thought that would be high, but that's decent.
No, that's ideal because then that's about 3 liters, 2.5, 3
the most-
liters,
Oh, is that 3 liters of
and
drinking? Okay.
that would be a good figure.
Okay. Well, that's the thing. Everyone knows that they should be hydrating, but then everyone complains that, I can't drink so much water. I can't drink so much water. So you've seen this. So what would you recommend in terms of how people should actually be consuming that?
It's very easy. Every hour and a half, just drink 200 ml of water.
Okay.
People go 4 hours without drinking water. They're at work, they're doing something else, they're traveling. They don't realize it, and then suddenly they're thirsty, but come on, you can't drink a liter at a time.
Yeah.
You're 1 glass,
Right.
2 glasses, and then you're done. And then they don't drink again for another 4 or 5 hours. So small,
sipping.
keep sipping small quantities every hour,
Right.
every 2 hours, and that will keep you well hydrated, keep your kidneys good,
Okay.
prevent a whole lot of things. Yeah.
So what are the most common things that you deal with, particularly for the kidneys?
So as a urologist, mainly stones.
Really?
Yeah, kidney stones, ureteric
What causes
stones.
that?
A lot of factors. So
Yeah.
primarily dehydration.
Common. Okay.
So less water is the main causative factor.
Right.
Less water, you get concentrated urine made in the kidneys,
Right.
and then that leads to these small crystals. So it's crystal over crystal, and then you get a big stone there.
Okay.
And sometimes if you're unlucky, one of those stones comes into the ureter, and then you'll end up with excruciating pain. Yeah.
Right.
So I would just say that just keep drinking water.
Kidney stones is the most.
Kidney stones, I think
Common one.
that would be the commonest urological condition that we face in our practice.
The most popular cure for that, apparently, for a lot of people is beer. Is that right or is that wrong? Is that a myth?
Yes and no.
Yes.
Because so what beer would do is, yes, may help flush out some small stones.
Okay.
It probably would not prevent stones.
Right.
And on the contrary, you're drinking beer and then you're dehydrating yourself.
Yeah.
So, you have a binge at night and then you've not drunk water and then you're going 8 hours without anything. And that's the time when, stones are like, now concentrated urine, let's get formed.
Yeah.
So that's why I said good and bad,
So avoidable,
avoidable.
more than likely.
But if you do have a glass of you have a glass of water with it.
Okay, fine.
Yeah.
That's
So that's what I tell
That's
my
a
friends and patients.
that's a good
and that's what I follow. Yeah.
that's a
Yeah.
good balanced
Yes.
answer to give.
Yeah. I mean, life is about moderation and balance. So
Yeah,
that's
absolutely
why
right.
you should look for it everywhere.
I love that.
Yeah.
So what are the other common things that you deal with other than kidney stones and like UTRs?
So UTIs,
Or UTIs rather, yeah.
UTIs, prostate enlargements.
Hmm.
These would probably be the two other things. And then all the symptoms associated with the prostate enlargements.
Right.
So I mean, people will just have problems passing urine, either obstructed urine flow, or just too much when they have to go very urgently. They
Right,
go
right,
very
right.
frequently, and I mean they don't know what the hell. They can't differentiate one from the other.
Okay.
So that's where we help them find out, what's wrong with them.
Anything we can do on the preventive side for urinary tract infections?
So that's a little difficult.
Okay. How does one get one then?
So again, dehydration.
It really comes
That's
down
the
to
number one cause. Yeah, it all comes down to that. Water is the cure for a lot of things. Yeah. So stones, UTIs. I mean, a lot of that can be sorted out by water.
Right, right.
It may not prevent both these diseases altogether, but it will definitely reduce the volume and it will help in the treatment.
Okay.
Other than that, I mean, it's really cleanliness, hygiene, and active lifestyle.
Okay.
So keep your kidneys functioning well.
Right, right, right.
So keep them flushing. It's like a car. You love cars. I love cars. What's the best thing for a car? You keep driving it, right?
Yeah.
Keep the lubricants all around.
Right,
so
right. Keep servicing
drink your
it.
fluids. Let your kidneys work.
Okay.
And I mean, if you think it's not going, you feel they're not going well,
Show it to
you
mechanic.
show it to a urologist. Yes.
Oh, well.
Or a nephrologist. I wouldn't want to leave out my colleagues there.
Yeah, fair enough. But then what are the other early signs that one should be looking out for in UTIs? I keep saying, yeah, UTIs.
So the earliest thing someone would get is, burning.
Okay.
Urinary,
Burning sensation.
burning sensation while passing urine. They need to start going a little more frequently. They get a lot of urgency, fever, yes, no, with chills. Those are all the UTI symptoms.
Okay.
And people, some of them, yeah, do seek medical attention soon. Sometimes some people just delay it
Okay.
for various reasons. I
Right.
mean, can't get to a doctor, or it'll just get well, and then it comes full blown with kidney infections.
Okay.
So it's better to just get to the hospital as soon as possible.
Right. So coming then to the prostate, what are the typical myths and things that you would typically have to bust for people? Like prostate is someone. I'll be honest, if I think prostate, I don't know much about it, so I always associate it with cancer.
Okay.
So
Yeah,
someone
so
had to
all-
bust a
Yes,
myths
yes.
of
So
that. What are the common things that
does
you would
that is a myth. I mean, some people do think prostate enlargement means prostate cancer.
Right, right.
And that is why sometimes they delay seeking medical attention, fearing it would be cancer, and are missing out on just getting treated for a benign enlargement of the prostate. I mean, benign enlargement is just
Very common.
age-related,
Yeah.
where there's hormonal changes, and beyond the age of 45, 50, the prostate starts increasing in size.
Okay.
And
You're
as
saying
it,
that's completely natural.
it's completely natural, yeah. And as age advances and as size increases, the individual would face some urinary issues, like I mentioned earlier.
Right. Like either being too much or being too little.
Yeah,
or
being too
something.
little.
All
The flow is
processes.
slow. They need to wake up a lot of times at night. And but 90 to 95% of those prostate enlargements are just benign. So, less than 5% would be due to a cancer or harboring a cancer in there.
Okay.
So it's much easier to go and get treated for those 95% that are not benign. I mean, that are benign.
And what's the
and
treatment
get
for
on.
that?
So we have medical management first,
Okay.
which takes care of a large chunk of these
So just basic
illnesses.
medicines.
Yeah. So there are drugs which help you pass urine easier.
Right.
There are drugs which reduce the size of the prostate a little bit. There are drugs which relax the bladder. And so we give these alone or in combination and see what's best for the patient. And if those don't work or after a while those stop working, we have a whole lot of surgical treatments. I mean,
Okay.
the age-old, still gold standard of resection, either with a plasma or a laser.
Okay.
This new fancy water vapor therapy that's come up, which
Oh
is
yeah, what's that?
still in its early infancy.
Okay.
So let's see how that works out.
Oh, what is that?
I don't want to comment on
You
that.
don't want to, okay, well, like people, I suppose, can look up Google and see what that.
Yes, yes.
I'm not
of course.
advising that they should do
It's-
anything, but
No, it's good and bad. It's got its advantages. So used within the set parameters, it's a good thing. It's called Reason. So people seeing this podcast
right,
will definitely be able to look
Okay.
up the whole technology on the net
right, right.
and ask the urologist about it,
Excellent,
which is
thank
much
you.
better.
Absolutely, that's why you're here. But I will go back to actually one thing that you were talking about a little bit earlier. And you were talking about sleep and number of times that people wake up to
Yes.
go to urinate
Yes,
in
yes.
in the night.
Yeah.
What is
So-
a decent number that would be?
I mean, so once is all right.
Okay.
Because you really can't expect someone to sleep for 7-8 hours.
Yeah, I can't do it. I have to
I
do
mean,
once
and,
or maybe
yeah,
twice.
you should
actually.
sleep for 7 hours
Yeah.
at night. I think less than 6 hours is not too
Right.
good. There are people who get off with 4 hours,
That's-
but generally 6-7 hours is recommended.
Yeah.
So once at night is okay, but then once when it's happening 3 or 4 times, so maybe the bladder is probably not emptying out,
Yeah.
so it's always remaining half full, and so it's filling up faster.
Okay.
Or the bladders just become overexcitable. So what we call it overactive bladder.
Okay.
And so it fills up with a 150, 200, 100 ml and the individual has to wake up and needs to get to the loo.
Okay. So they do
So-
that more frequently.
So they need to go more frequently.
So then, what do you recommend? Do you think people should sort of try and taper off their water?
Taper
intake,
off the
nighttime?
nighttime water intake. So somewhere after about 7 o'clock, 8 o'clock. I mean, people textbooks say 5, but I mean in India we don't eat till 8 or 9
Yeah,
at night.
yeah.
So we are not ones for early dinner. So I tell them drink water and don't sleep for about 3 hours after dinner anyway.
Right,
So
yeah.
that's also not very healthy for you. Going to sleep right away.
Yeah.
And then don't drink water after dinner's over. So that helps a fair amount of people.
Yeah, I've noticed. I've started doing that, and that's actually helped my sleep
Yes.
as well.
Yes.
Because
And then there are people when they wake up to pass urine, they drink water again. Because they're
I
like,
used to do that.
yeah, we've just passed urine. Let's not get dehydrated. Let's drink some more water.
Water.
Okay, you're waking up in 2 hours again.
Yeah, it's like a vicious circle.
Yeah. So just stay low on the water intake at night.
Right.
You have 16 hours in the day to drink 3 liters. That's enough.
Yeah.
So that's okay.
Okay. Well, you've seen many cases as an expert. So, what are the things that you adopt in your good habits every day to?
I shouldn't talk much, but yeah, stay well hydrated. Try and lead an active lifestyle, as in not just come to work every day, but a bit of exercise, a bit of cycling, a bit of golf, a bit of
Right.
gym, and yeah, eat healthy.
Actually, yeah, that's a good point. We didn't talk too much about eating. What are the kind of foods that you would recommend for
For the
healthy,
prostate,
for the healthy kidneys, for the healthy prostate,
okay.
for general flow?
yeah. So I mean, everything in moderation is good.
Okay.
And anything good had too much is also bad. So there are foods which are supposed to be promoters of kidney stones. Like you have the oxalate stones, for example, which with a lot of spinach. So that's a type of stones. You have oxalate stones, uric acid stones, you have infection stones.
Okay, I didn't know that actually. I thought they were only uric acid ones.
No, the whole different types.
Acha,
So there are these which beetroot and mushroom and spinach and a lot of red meat, and so those promote oxalate stones.
Okay.
So when patients come there, they say, "What should we not eat?" And I say, "Okay, don't eat this, but what's important is there are a lot of things that are good for stones. So please eat those and please have those. Like
yeah.
enough water,
Right.
coconut water."
Okay. That's what you're having?
Yeah, that's what I'm having.
Okay.
Lime juice, bananas, a little bit of green tea,
Right.
stuff like that, barley, oats.
Okay.
Those are foods that help prevent stone formation.
Okay.
Once you're eating those, you can have these other things once in a while. So I'm not saying don't eat meat.
Just bring things, as you said, balance.
Yeah, balance it out.
Okay.
Yeah, so that's with the food thing.
Okay.
Prostate, really, there's really nothing much. Some people will say eat a lot of tomatoes. It's here and there
Yeah.
again. I wouldn't say controversial, but debatable.
Yeah, fair enough.
Yeah.
Okay.
And yeah, just activity. Active lifestyle is very important.
Right.
Because they found even in people who are bedridden and so it's just because of their metabolic upkeep, they're forming stones. Because the metabolic breakdown or lack of metabolic breakdown in the body, the stone formation happening in there.
I see. How long do these
So
kidney stones usually last? Sometimes.
How long do they last?
Yeah.
They can stay in forever
If you're
till they
detected.
don't cause a problem.
Okay. Interesting.
So they can just be in one area of the kidney, not growing too big.
Yeah.
Or on the other hand, they start growing big and slowly just reduce the kidney function. They block the kidney up
Without you realizing.
without you realizing it. I mean, there are also so many patients who've had a stone come down in the ureter, excruciating pain, come to us.
Yeah.
We've told them, okay, you need this. I mean, we do the sonography, CT. You need to get it out. Or if it's a small stone, we give them some medicine which can help pass off. And they don't come back. And they go and they try something alternative, which is also fine. I'm not against that.
Yeah.
But they disappear for about 6 months to 1 year because the pain goes away. The pain goes away because the kidney reduces its function. It's not producing as much urine as it was.
Okay.
So since there's not much of urine coming down, the pain in the kidney is gone. And they don't realize that. So they say, the pain's gone, my stone's gone. And a year later, they've done a sonography for some other reason. And then they found there's still a big stone. And the kidney is huge. And it's not a very well-functioning kidney. So if you have been diagnosed with a stone, make sure that you see it's gone out. Like an unwanted guest at home. You make sure he's out of the front door.
No, but that's again comes back to regular health checks and making sure that it's
regular health checkups, and especially checkup of something that was wrong.
Yeah, absolutely.
People just neglect that, and then they say, no, I'm feeling good.
That's very interesting that you said that. I don't think a lot of people, at least I didn't realize that.
A lot of people do not do that.
Yeah. No, the fact that if you've had like a kidney stone, you've had the pain, etc., and you think that you passed it, and the pain stops, you think that, okay, I'm good now. But it's actually a problem that's just...
If you've not seen or felt, you will feel the stone passing out.
Yeah.
Is what I have been told. Luckily, I haven't been a victim to this.
That's probably because
you will
hydrated.
Feel hydrated. You will feel the stone passing out.
Okay.
You will see the stone passing out. So if you have not experienced that, better go and repeat the test to see that there is no stone anymore.
Okay.
So that's what I tell them.
Okay. Well,
not everyone follows our advice.
Well, that actually ties in well to my last question that I have for you, Doc, is that if you had to leave us with one important message, what would that be?
Be happy, remain well. And I mean, I said a lot. I mean,
stay hydrated.
Stay hydrated, I think,
At least what we've been talking about.
Stay hydrated and don't be scared to visit your doctor.
Yeah.
There are a lot of patients who, I mean, I'd say patients, but a lot of individuals who, the elderly ones who don't come in to the hospital because they are embarrassed, especially with urological diseases.
Yeah, I can understand that.
So they are getting old and they just say, okay, this urine problem started. I mean, guys with prostate enlargement.
Yeah.
And it started, but we thought it's part of old age. And so we didn't come. But now it's real. I said, why have you come now? It's really bad now. I said, okay, you should have come in like 2 years ago. Because you say, I'm having this since 5 years.
Right.
So you should have come here many years ago. So visit the doctor when you feel something is not wrong with your body.
Yeah, absolutely. And there's nothing wrong with that.
There's nothing wrong with that.
Absolutely.
Yeah. If your car breaks down, you take it to the mechanic, right?
Exactly. Yeah, absolutely. Even if there's something small.
Yes, even if you hear a noise you're not supposed to hear.
Right. Well, thank you so much for being here, Doc. It's been an absolute pleasure talking to you.
Most welcome. My pleasure once again.
And absolutely.
Thank you so much.
Absolutely. But the takeaway for me is something so simple. Just stay hydrated. And it's so easy to do that. It'll solve so much of your problems. Right. And if they do have a problem,
I'm always there.
They can come and see.
There's a whole lot of us here.
A friendly face like you can only cure someone. So
thank you so much, Kavas.
Thanks a lot.
Thank you.
Thank you all and look forward to seeing you for next week's episode. But before you do leave, do not forget to hit the like and subscribe buttons here at the bottom. Thank you.